Shalom. All praises to Yahweh, Ba'Shem Yahushua, Ba'Shem Muhammad Kadash. Double honors to the apostles and elders, great millstone, real well. And shalom to all the brothers in the work, Syrian truth. Got this article on Bloomberg Quint. It says what? New York City brain computer startup announces FDA trial before Elon Musk. So it's funny because when what's his name? Elon put his thingy out there. What the fuck is it called? Neuralink. Put his product out there. You know, the brain chip, the implantable chip in the brain. It was yeah, funny as hell. And he was doing it. There was like, you really think that this guy was the only guy working on it, but it's there's hella other companies that are just like popped out of the woodwork, working on the same thing. It's like, Neuralink, they got the videos, the footage of like the monkey moving it around and all that, and obviously it's Elon Musk, so he can kind of push it out there harder. So and it's funny as well because they mention it. Okay, I'll read it. I'll get to it. So it says, a brain-computer interface company is entering clinical trials for its implants in the US, a big step towards getting the futuristic devices into more skulls to help treat conditions like paralysis. New York City-based Synchron Inc. said it received permission from the FDA to test its device on in-human patients. The trial, known as an early feasibility study, is essential to proving implants work safely and could one day be sold in the US. Yeah. And okay, let me read a bit more. So it says Synchron beat other companies, including Elon Musk Neuralink, to announcing that it secured regulatory approval for tests of a commercial product in human heads. Commercial is another way to say practical and applicable to real life, said Dr. J. Mocker. Well, yeah, the funny thing he says is commercial. Because as far as for commercial, it's that's funny as hell. For commercial, because that means that there's obviously been like military, there's been other like avenues before, probably where the same thing's been looked at, but it's just not been out in the public eye, because these are the ones being done commercially. So that's this thing's been in the works for longer than the last few years. It's obviously been in the works for far longer. So neurosurgery. Okay. Commercial brain-computer interfaces are a relatively new area for the FDA. The agency plans to hold a webinar on Thursday when it will provide further guidance on topics such as how to design appropriate clinical trials. Yeah, so, those implantable, microchips that go inside the brain, these things have, it was mentioned time ago that the Supreme Court was basically going to have to, hear cases on this. I believe Joe Biden that said it. The apostles brought it out. Because why? It's funny still. But yeah, these things have been in development. These things have been worked on for a long ass while. These things have been in the work for a real long time. It's it's not just a thing that's just jumping from nowhere. And that's kind of the mentality of a lot of people. They're just kind of like, oh, but they're not clued in. They don't really know what's going on, and that's why for them they're saying like, oh yeah, it's just the future. Just blah blah. Anyway, let's see how much money this is getting put into this. says venture capitalists are suddenly eager to embrace the technology. So far this year, brain computer interface startups have raised 133 million. So money's getting whopped in. Whop is getting dashed in for these men. Fucking hell, it's kind of wild. A man said there's a bunch of them just just starting up. There's multiple startups. So it's obviously like viability's been shown. Now you got multiple people jumping in, and it's gonna go mainstream. People are just gonna be like, oh yeah, they're going for the health angle. Oh, if you're paralyzed, blah blah blah. But it's gonna be a thing of just people getting down. According to research firm PitchBook, that already exceeds the capital raised in all of last year and is by far the most since 2017, a year when Neuralink took in $107 million. Yeah, I think 2017 might have been when they first started kind of saying what they're working on. Because I thought it was 2000. It probably was. Because yeah. Oh, maybe that was just when it started. Because I think it was. Because he started a lot of them at the same time. Even did that fucking underground motorway bullshit. I wonder how much money he got for that. So I said just last week, Paradromics said it raised $20 million. So people are putting money in. Those guys at the top, they're putting money into these things. Because why? It's with it. It's part of the plan. Synchron has already performed multiple tests of different varieties, including an earlier 4-patient trial in Australia. There are a range of safety concerns that haven't been dealt with, including cybersecurity. Fucking hell, cybersecurity, which is a big part of the discussions we've been having. Also, someone could hack your fucking brain. That shows, what's the word? The how the extents to which this technology is gonna go. It's kind of wild. It's kind of wild still. Can't even lie. It's kind of wild. The big part of discussions we've been having. So it says the company plans to place a device called Stentrode, which is smaller than a matchstick, in the brain to help paralyzed patients control digital devices like computer cursors through their thoughts. The implant works by communicating via a tiny wire with a second implant in the chest. Oh. So there's more than one. It says a transmitter that sends signals to the computer outside the body near the patient. Later this year, Synchron plans to enroll 6 patients in its US trial. So this year, yeah. And I think Neuralink as well is gonna be this year. So hey, soon you're gonna have people with those implantable chips real soon. So later this year, plans to enroll, which is roughly analogous to a phase 2 clinical trial for a drug. Unlike many other implanted brain-computer interfaces that require brain surgery, the Stentrode device gets implanted via a blood vessel on the back of the neck and is maneuvered towards a vessel in the brain. Fucking hell. It's kind of wild. If the study is successful, Synchron could move to the next step in the years-long approval process. Says it could be on the market in 5 years. So real soon. And depending on, it's like the one they got from the Pentagon, where the one from the Pentagon, which was a treatment for this thing going around. So yeah, you can see these things accelerated, man. But it's all Esau trying to, essentially substitute himself in for Yahweh Hashem Yahshua. 2 Thessalonians 2 and 3. Let no man deceive you by any means, for that day shall not come, except there come a falling away first, and that man of sin be revealed, the son of perdition. Yeah, and that man of sin's been revealed. Esau's been exposed, man. The prophecy has been lined up. This guy's set his nest among the stars. This guy's, going around the whole earth. He's oppressed, both tribes, the northern kingdom, the southern kingdom together. This guy's done all. This guy's exposed himself, man. He's held on to that perpetual hatred. It's this guy's the one who exposeth and exalteth himself above all that is called the Most High, or that is worshipped, so that he as the Most High sitteth in the temple of the Most High, showing himself that he is the Most High. Yeah, that's Esau's dream. That's what Esau's really utilizing, that ingenuity, utilizing that technology that's been given to him for the sake of prophecy. He's thinking he's, somehow gone outside the bounds, the knowledge, or, the capability of the Most High to basically, for him to be able to replace the Most High, man. That's just really what this guy is intent on doing. But yeah, it's not, ain't gonna come to, but it's gonna go to a certain extent. He's gonna get that chip pushed out there. People are gonna be getting chipped en masse. But what, when he's about to fill his belly, Most High's gonna, just drop his wrath on him, man. There's gonna be a wrap. But yeah, I'll leave it there. Shalom. Shalom.